Good morning, everyone. Welcome to the Office of the Mayor. I want to show you this is what we've been doing for the past 3 weeks. We have Dr. Safier, Superintendent of Gloucester Public Schools. I have Karin Carroll, the Director of the Department of Public Health, and our actually major liaison and welcome to the City of Gloucester. Today's discussion is most of us have been on conference calls, the three of us, staff, other people, and the conclusion of what we've been doing in the City of Gloucester since, technically, I'm going to tell you a secret. Our wonderful director here has been on top of this for over 2 months when she ever heard of it. A month ago we have, but 3 weeks ago, it's been a morning conversation. It's been happening every day, what we can and cannot do. And Gloucester actually has been called, we're overreacting, but we've been proactive. And because of that, we have good news. No one has it yet, and I can't say not tomorrow, but as of right now, the precautionaries that we're doing is ahead of what is mandated. So I'm fortunate that we do have a great teamwork, and thank you to my DPW workers because they are keeping things right on the ball. And I love the fact that my director says we have a new sanitizer that it's good for the environment, but it's going to be better, and that was sent out, and our janitors have all the protocols what need to be done in our schools. So, Dr. Safier, was you on the conference call? Which one this morning?
I was on the conference call with the Department of Ed and the Department of Public Health. But before I go there, I just want to thank you, Mayor, and Karin as well. Your leadership and the ability to work together and to keep us informed so we can make informed decisions has been second to none. I really thank you so much for that. So, yes, we did listen to a conference call this morning. In essence, the Department of Ed, Department of Public Health are saying that whether or not to close schools is a local choice. And as you have already mentioned, we have not had a documented case of the coronavirus here in Gloucester. Nonetheless, the cause for concern across the community has reached a critical mass. And people are sort of reeling from that. So collectively, we do feel it is the right decision for us to close the schools for 2 weeks. The Department of Public Works is going to come in starting tomorrow, I believe, to begin the process of deep cleaning. And we will be working on a whole host of different issues. For example, working with our teachers, even remotely, to provide information and materials for students, suggestions, recommendations that they can work on. We're going to be working on providing meals, lunches in particular, for students who are in need. We have to figure out what we can do and what services we can provide with respect to special education. So there's a host of logistical kinds of things. I had met with the principals, the leadership team this morning, and we will continue through our Google chat and through our conversations to really iron out many of the specifics in order to make the next 2 weeks be as smooth as possible.
And when you were on that conference call, I'm sure you understood as much as I did. Was it mandated that we close schools? How are they doing that? Who's mandated? Is the governor going to mandate it? Or could you explain on that?
Yes, it has not been mandated at this time. It is a local choice, and this is a strictly precautionary measure. We just want to make sure people are concerned, people are anxious. It just gives everybody a chance to take stock, to know that we have our plans. I'll be sending out what our plans are for dealing with the situation should it actually get worse. And we'll clean up the buildings, make sure they're ready to go, and we're just going to take the 2 weeks for everybody to calm down, get ready, and then hopefully be able to come back, and that we won't be afflicted, by an outbreak, which has not happened. That's not happened here.
Right. Well, I was on that same conversation, and it was 1,000 people, and we actually, some of them had to get off, so they could actually have the commissioner come on. Wow. And next one, they said that they're going to do this every Friday morning. And the next one, they're going to give us a new number that more than 1,000 people can come on. And you can ask your questions, which were limited. And, it was the address of some of the questions couldn't be answered. And that's because, as you know, it's an ongoing process. And so your conversation this morning with your conference call, how did that go?
Good. We did it remotely for the first time virtually using our city platforms. The Google Calendar has a great little button you click, and it was easy. We had community partners calling in. We had probably 30 to 40 participants on the call, and from the few I was able to catch up with, people could hear well, they could hear the questions, and we were able to have our twice a week we're planning meetings with community partners, emergency management, hospitals, all the folks that we need to be sharing ideas, resources, concerns. And that worked really well. And our IT department was great in helping us get set up, but it was pretty simple technology, worked well, and kept us all apart. So we're reducing some risk there of exposure. If one of us was exposed, we didn't want the whole team to have to not be on deck. So it was a great idea. It was an easy solution. It's probably saved a lot of time as well, people coming into a meeting. And we talked about a lot of things. So first, the hospital gives an update. Dave Lackalade, he lets us know what they're seeing at the hospital end. He clears up questions on protocols if people are wondering how to access the hospital, what kind of visiting protocols they've enacted. So at this point, they have restricted visitors to, I think, 1 a day, and they're doing screening as people come in so that they're reducing, again, the risk to their patients and to their staff. So we're really concerned. A lot of the agencies on board talked about the need to protect staff and what to do if their staff do get sick and they need more help. So we shared some ideas there. We have an inventory coordinator who listened to the needs of the various agencies around protective equipment, hand sanitizer. He'll be collecting those needs. He'll be asking for resources from different agencies that we have access, and then helping to prioritize and distribute them here in the community. Our action shelter is also involved in the call, and they're helping us to think through persons who are homeless, what we would do in those cases if we had to quarantine someone or if we needed some more space there. So we kind of run right through the entire city as members of the school community there and our daycares and preschools who all have the same kinds of questions. So it's a great chance for us to talk twice a week and then loop the mayor back in as to what the community's doing and what people need. If we hear of needs or if we hear of common themes of people don't know what to do or people don't know where to get tested, we address those in our PR as well that's going out daily. Mm-hmm. So it was good. It was good to do it virtually. It worked real well. We were able to have people ask questions and field those questions. And I would say it was a new first for us.
I can say that the city is very, very well prepared. The very first thing that Karin and the health department did was set up an incident command structure so we know if there's a particular situation, a particular circumstance, all we have to do is look at the chart and that's who we contact. Yep. I've made several phone calls this week, cell phone. I've got Karin's cell phone on my speed dial now, and every time I've called, I've been answered immediately, and I can ask questions about certain situations or potentialities or what have you. So the responsiveness and the preparation and the structure, all led by these two folks, we're in very good shape. And again, it's not here, but we're ready.
Thank you. And the fact is, we also have conference calls with the mayors. They set up one with Marty Walsh and Joe Couture from Somerville, and they also had that you could go in, and I chose not to go in because I had other conference calls. And so I had my team listen in while I did the things that I needed to do, and then we followed up in the afternoon. And I asked them who was there. Was the Department of Public Health there? And was other people there? And they said they had specialists from hospitals. And I says, come on, guys, I've been working 20 years in healthcare. I told them, have you closed your senior centers, activities for seniors? I says, I closed bingo down. And I thought the Catholic community was going to come after me. We closed that down. And I says, even our novenas that we have here, explain to that we are so ahead of it. And he says, oh, don't stop praying. He goes, how did you close them down? I says, we have museums that are closed. We have programs that are closed. The chamber just was so corporate, the Cape Ann Chamber. They closed their events. They knew that, you're going to, even though a place can hold 200 people, but it's not going to have the space that you need to be in order, like we have here, in order to be with each other. And so they canceled theirs. There were events all weekend long. There was, activities, school activities, after school programs, fundraisers. I said, we already canceled those. And they were in shock that, how did you do that? I says, well, because we put out a memo right away. We said that if you can't follow these guidelines that we're going to ask you. Our library, the friend room's small, and if you have more than so many people in there, you're going to have to cancel that program. So that's what we did. And there's other programs in Gloucester like our archives. So if you need archives, we allow them to stay home. They are seniors, and it's hard, and they deal in close environments, so our archives are closing. We're meeting Monday with our staff with the city, to figure out what is essential, non-essential, because we do have contacts with people, and sometimes, like, the Shine was closed. I volunteer and you work closely. There can't be a distance, and you don't. Our major thing that we looked at when the first week we worked on was how do we help the most vulnerable, was people who are ill, people who are dealing with chemo, radiation, the immune system's down, people with asthma, seniors. And so the first meeting that we had actually was with the nursing home facilities, is how can we assist them, what can we do, what's happening in there, how are they doing their protocols. And one even called people up and said, no visitors, until we can get this down, because you know what, there's shortage of staff, or there's shortage of this or whatever. We want to protect the people who are there. We had our veterans welcome home, that the veterans, Adam Cooker said, you know what, it's going to be hard. That was that is now stopped. The networking on Fridays, that is now stopped. He also reached out to the state and said, you know what, I don't want to have to put my senior veterans who get this Chapter 115 to come get their checks and go through that protocol. We're going to be able to, with the approval of the city, which I did, could be able to mail actually their checks to them, and or a direct deposit, how they're going to have it set up. So there are things that we did that already. We met all the time with our social services. See, in the summer we meet with our social services in case it's too hot. What do we do with our seniors and people who don't, or if we lose power? In the winter, we also meet again with Dr. Safier. What do we do for the schools, open and close them? How do we handle this? Mm-hmm. This was 1 or 2 days. This is very new to us, because a quarantine is 2 weeks. Snow, thank God, it's only 3 days max. Right. But this is a 2 week, and so how do we do that?
Working together you set up is not new to us.
No,
so it felt very natural. We have these relationships. I can call Rich, I can call Julie at Open Door, and it's all set up, and we're kind of used to working like that.
And when that's what, and you know what, we're so lucky because we have Senator Tar, Representative Ann Margaret Ferranti, regular weekly Fridays, whatever, monthlies. We know they're in here all the time, and texting virtual. I think we invented it because we lived around the corner. We used to holler it out the window, so that was virtual. So that's how we worked. And you know what? I just got a text from the Lieutenant Governor. I guarantee you, every other day we're on the text with the Lieutenant Governor. Yeah. We had concerns with the economic impact that's going to have small businesses. Right. So we have our economic developer, Sal, working with the Small Business Association. Yeah. I talked to Secretary Keneally of Economic. Congressman Moulton, we were supposed to meet, but we all decided virtual, and we had a conference call with him, and Dr. Safier sat with me during the school committee meeting, and then we're going to have it again with just the mayors. There were things that we're looking at, how do you deal with, as we know, rent's high, and you have sometimes maybe 2 or 3 families living in one apartment. You have people who are documented, undocumented. Are they going to be able to get health care? Are they going to be able to get the testing? Absolutely, in my city you are. And so I have a background in healthcare and insurance, so they know and they trust me. And the fact is, what do you do if one family has 3 families in them and you quarantine them? What do we do with the methadone clinic? What do we do with the Grace Center or the Action Center? We have senior care. We have senior center. We have PACE, Day by Day, Meals on Wheels, Open Door. And I said, you know what, Action Shelter, 6 senior complexes. One is right across the street. If you quarantine, how do we do it? We have actually everything in place except for one thing. We still haven't gotten a really good answer and that's where we talk about the Lieutenant Governor is, if I have a person who's going through addiction, has to be quarantined, do we have a rehab that we can put that person, because that person will go through withdrawals while they're going through addiction. And if you have like in the Action Shelter, you have to stay in place. If someone's quarantined, no one can leave. What do? Do you get that person in any medication? Do you get that person, what's happening? So no one's staying in shelter because that already started that rumor. But what we're saying is, We thought of all the worst scenarios that could possibly happen. And we addressed those issues first.
Yeah.
And the only one is, like I said, is the rehab quarantine.
Yeah.
So every other issue, we did everything you can think of. And then we started going down. Okay, so now this, and this, and this, and the businesses and this, and everything you can think of. And just to reassure, the three of us, have decided after the conference calls that yes, the schools will be shut, not because they have to. We are going to do, and it's not because they're not clean, is we want deep cleaning. It's the difference of cleaning every day, and our DPW has been right on top of things, and we've been emailing and working and meeting with the director of Public Works, Michael Hale, because the fact is he came up with a new sanitizer, a new cleaning device, which is for everyone, environmental safe, and also for children who can have certain chemicals and stuff. So we thought of everything, and it is clean, but we want a deep clean, because just because it's not here doesn't mean it's not going to come here, and it doesn't mean that it could be here, because the testing does take 2 days.
Yeah,
so
that's true.
As far as now, we know there's 108 cases in Massachusetts. There's none in Cape Ann area. It's Essex County, not Essex Town. So we don't know which town. They haven't let us know. No one has died from it. And we can't say it's because of all travelers either. They said that today. It's not. We can't say how they got it anymore, because it's such an unknown. Mm-hmm. And so that's why we decided that we're going to be proactive, and we're going to take measures to the extreme, so we already have them in place and know what to do. Yeah. So that's why I said I realized that Dr. Safier is going to continue to work with the schools, because we're not going to shut down forever. And what do we do? And if the scenario changes daily, how we're going to do it, and we're going to keep this going. So Dr. Safier,
I just want to say something that you've spoken at length about taking care of the most vulnerable populations in the city. But it seems to be a fact that the virus does not necessarily impact children.
That's correct.
Right?
Yeah.
But it does the elderly.
And they could be carriers, so we want to protect them and tell them wash.
Exactly.
Always wash your hands.
With that said, we want to do our part to stem the tide for potential transmission, and by shutting the schools down for a couple of weeks, we should be able to do that.
And I think that's the point here, is trying to get some space between people. If we had a call with business community yesterday around thinking about capping their groups, their business events to less than 50 people if they're in close contact, and also think about the capacity of the room so that people aren't bumping into each other. I know it's a time of year when people are having masses and novenas and home gatherings, and we understand that that's a huge sacrifice to community members, individuals, but we're hoping, like Dr. Safier said, that if we do these short-term sacrifices, that we can avoid a longer-term outbreak. And that's kind of the name of the game for us, is that individual just keeping that distance, and those basic precautions of washing your hands for 20 seconds every time you shake someone's hands, every time you're out and about. We had a concern raised on our call this morning that we're trying to address as well around the grocery stores, that there are now so many people in the grocery stores, they've become like a hot spot of public health and germs. So we're not, we're just going to make sure that we're communicating good protocols, infection control with those people in the grocery stores, and there have been great partners with our health department. But when people leave there and go home, they should remember to wash their hands really well also. So that's really the best defense we have, is keeping a little bit of distance from someone who might sneeze or cough. It still spreads similar to a cold or a virus or a flu. So you really have to be 3 to 6 feet for 10 to 15 minutes, or actually get sneezed on. That's still the main mode of transmission as far as we understand. We've heard it's possible to get it from a cat to a person or a dog. These are things, is like Rich said, Dr. Safier, we don't really know all these details of transmission, but the main transmission is still like any viral respiratory illness. It's going to be if you're in close contact with a sniffling, coughing, sneezing person. So it's these prevention steps of just trying to keep your distance, wash your hands, especially if you're caring for an elderly person or someone, like the mayor said, with a compromised immune system. So, those are the things we really want people to always be thinking of. Am I going to be taking a germ back to a family member that I might be caring for or seeing? So we're doing a lot of things on the city end, the planning end, the school end, but we need individuals to make some sacrifices. We know that's hard, and we know it affects people's income as well. If they can't work or they can't go out or parties don't happen, then DJs don't get paid, and people who rely on that, and we understand that is a big part of this. So we're working really closely with that business community and people in the community that might need support to direct them to the resources that are available in our community. So like the mayor said, Sal in our community development office has been a great liaison to making sure that employers in the community, whether they're a small business or a 1 or 2 person operation or a big company, that their employees might have financial needs. He's working with them, trying to support them.
We also asked with Action Shelter, who does Action Energy, and the Open Door, who does SNAP, is we have a lot of small businesses and if self-contractors that, when you try to apply for a program, they say we need your last year's income taxes. Well, last year everything was great, so what do we do today? We're working with the state on that. The federal government promised a lot, and I talked to Congressman Moulton about that, and they're going to see what they do, but I'm going to rely on my state because I can actually get better information from my state, because right now federal government is saying they're going to put this money, but they haven't given it to the state yet. So the state is already putting money aside. I know that Senator Tower is working on a bill, especially for healthcare and what's going on that fact. And my concern also is that Julie LaFontaine from the Open Door said, please, anyone can go there. Anyone can go in, and that what they're doing too is that to make sure you have the distance, they're allowing certain people to sit in a certain area, and they're going to say when you can go shopping and get your meals, it'll be 4 a person there, and it'll be different. The meals were going to be served there, and they're going to be taking care of people, and it's on the go, so we don't have everyone congregating in one place, and so you don't have to worry about it. Everything is being handled the way it should be handled. And like I said, we're very fortunate in Gloucester because we've been working on this, and we do have a networking team, with the senior center, Scott Trenty with the Meals on Wheels, how we're going to do that, who incorporate with the senior center with Open Door, make sure that, people do have access. And I just love how, Action Shelter said, we're here, what do we need to do? And I said, do you need this? So we're making sure that, healthcare is there. We worked with the Fishermen's Partnership Support Services. They are called the Navigators through the connector, and they right away can get insurance online right away. So we have that connection, send it there, so we know that that's going to be okay. It's difficult because it's not okay if you're losing, right now 2 weeks, 3 weeks of pay, because that's how you survive. And, that's fine, Mayor. You can say, well, that's fine because that's not going to pay my electric bill. Right. That's not going to pay any of my utility bills. And so we're trying to see what we could do is to have the state contact the utility companies and let them know that no one should get a shut off during this time and be able to work on a payment plan after.
That's right.
Because that's a concern to a lot of people, is that, all right, I don't pay for 3 weeks, that's fine for you, but you have power. What's going to happen is I'm going to be shut off. I have children at home, I can't work, and what do I do? So we're working on, that's the main concern. I was talking to Lieutenant Governor today saying, can we talk to the utility companies and say, look, during this crisis, no shut-offs.
That's great.
We're not asking for a break, we're not asking, I will after, but right now we're saying just don't shut off.
Yeah.
And so can we have a different criteria for Action Energy to actually say emergency services, and here you go, like the Dr. Safier is going to do with the schools and the school lunches. We're not going to say, hey, are you this income? Absolutely not. If a child wants some food, the child's going to be fed, and that's what we try to work on here. Yeah. And just so you know, I know right now I'm not shutting the bridge. I was just making a suggestion saying we are so proactive in this community. We work so well in this community that I wish I could shut the bridge and just stay here for 2 weeks and we'll be fine. Because we could all go out because we're fine here. That's being said, no, the traffic's going over the bridge. We need deliveries. And that being said, I just want to thank the community. It's scary. Am I scared? Absolutely. It's because the fact is I'm around people all the time. And I've hugged everyone all the time. And the fact is it's unknown. If I knew, okay, it's a flu, we can do this measures. It's things we don't know. And I have to worry about my employees too, the ones who are cleaning the buildings, the ones who are dealing with the schools, the teachers and the principals, the staff here, the Board of Health. Are we all going to be in one place, one gets it, then the whole city shuts down? How are we going to work this out so that, you know what, you might have to wait, you might have to be a little inconvenienced on how you pay a bill. We're looking at not to charge late fees. And maybe you can do it online, and the ones who can't have a Dropbox. We're working all that because the fact is I have to take care of my city employees too. So with that said, I hope everyone has a great day. Is anything else would you like to add?
No, just hang
I
in
think
there.
so. Wash your hands, be healthy. Get
Wash your
outside.
And
hands.
she
Get
taught me that
outside.
if
Get
you're
the air.
washing, go outside.
Go
Air's good.
outside. It will
Yeah.
spread those germs
Stay,
out.
you know what? That's right. Stay in your backyard if you don't want to meet anyone, but go outside. Going outside is
Yeah.
good. Take a walk on the
Yeah.
beach. It is
have
safe.
a walking meeting. If you're meeting with people, have that outside walking.
You know,
so that you're
what?
not
People walk at different
dissipating.
paces, so
Yeah.
it's all right. I'm over here because I'll still be back there, but it doesn't matter. And you know how you teach your children how long you should wash your hands?
Yeah.
And she says, "Sing Happy Birthday."
Happy birthday.
Twice. You gotta sing it
Happy
twice.
birthday
It's a
to
long
you.
time.
That's a lot.
It's annoyingly long, 20 seconds, when you're trying to wash your hands and you're busy, like all of us. But it's really important. It's based on science. We will get those germs down if you're rubbing those hands together with whether it's Purell or soap and water. 20 seconds. That's the magic number. So happy birthday twice.
Right.
All right.
Happy birthday twice.
Happy birthday.
Yeah.
Thank you.
Thank you.